4-year-old girl in pre-kindergarten. She weighs 54 pounds and has a body mass index in the 97th percentile for her age, meaning 97% of children her age have a BMI less than hers. Samantha is obese and her health is at risk because of this condition. Nicholas Reeves lives outside of Nashville, Tennessee. He is in 8th grade and weighs in at 117 pounds, which is more than his 13-year-old brother weighs. His body mass index is in the 95th percentile for his age. Nicholas is also obese and his health is at risk as well. This issue can affect any one of us, our siblings, our friends, or for those of us planning to have children in the future, our very own children. Childhood obesity is a growing problem in America, with approximately 17% of children and adolescents aged 2 to 19 years being obese, according to the CDC, Center for Disease Control. That's 12.5 million children. Obesity isn't just a health issue either. According to the AACAP, American Academy of Child Adolescent Psychiatry, obesity costs nearly $100 billion annually. The CDC defines being overweight or obese as having a range of weight that is greater than what is generally considered healthy for a given height, while the AACAP defines obesity as having a weight 10% higher than what is considered healthy for a specific height and body weight. Body mass index, or BMI, is the measure used to establish whether a person is overweight or obese. A person's BMI is calculated by age, weight, height, and gender. There is also different BMI scales for adults versus children. Childhood obesity has many various causes. One such cause is an energy imbalance. A person is taking in more calories, units of energy supplied by food, than they are burning with physical activity. Other causes include lack of physical activity, more access to unhealthy foods, less access to healthy, affordable food, increasing portion size, less physical activities, and more unhealthy foods available in schools and daycares. Genetics also play a part in obesity. If one parent is obese, there is a 50% chance that their child will also be obese. However, when both parents are obese, their children have an 80% chance of being obese. There are numerous consequences related to childhood obesity. Some of the more severe consequences are extensive health risks. At the risk of sounding like a prescription medicine commercial, these health risks include coronary heart disease, type 2 diabetes, cancer, including colon and breast, hypertension, stroke, liver and gallbladder disease, sleep apnea, and respiratory problems. Obese children ages 10 to 13 also have an 80% chance of becoming obese as an adult. If those health risks weren't enough to convince you that obesity is a bad thing, then also consider that obesity has economical consequences as well. Economical consequences include medical costs for preventative and diagnostic medical aid and the treatment of obesity. In 2008, obesity cost the United States approximately $147 billion. Morbidity and mortality costs are also included in economic consequences. Morbidity costs are defined as the value of income lost from decreased productivity, restricted activity, absenteeism, and bed days. Mortality costs are the value of future income lost by premature death. 6 months after joining a program to get Samantha Stevens and Nicholas Reeves healthy, Nicholas has unfortunately gained 5 pounds and his BMI has gone up. His family continues to work hard to return Nicholas to a healthy BMI. On the bright side, Samantha has lost 3 pounds and her BMI is going down. Her BMI is now in the 93rd percentile and she is no longer in the obese category. Childhood obesity is a growing problem in America, but it is a problem that can be easily managed if we stay informed and